A patient comes into the clinic with a suspected sprained ankle. What is the appropriate initial action of the medical assistant? So when we see a question like this, we want to focus on the ending. What is the most appropriate action, initial action, for the medical assistant? This beginning part, a patient coming to the clinic with a suspected sprained ankle, actually will not be very important to this question. This is actually just kind of side information on why the patient is coming in. What we really want to focus on is the fact that we're talking about the role of the medical assistant and the initial action of the medical assistant. So everything about the sprained ankle, we actually could kind of eliminate here and just focus on this ending. Option A says, apply a cold compress to the ankle and instruct the patient to elevate it. But remember, this is discussing the initial first action of the medical assistant. So we're envisioning here, the patient comes in, they're in the office, they're meeting you, the medical assistant, to greet them, get them situated in the room, and the provider has not seen them yet. So you as the medical assistant, it's not your responsibility to be coming up with a treatment plan, telling them to elevate the ankle, giving them ice. You're simply just bringing them to the room and getting them accustomed. So you can eliminate option A because that should come later if instructed to do so by the provider, or once the provider sees the patient, they may instruct the patient to do so with the ankle. Option B says, obtain the patient's vital signs and medical history. And that sounds like the perfect initial action and role of the medical assistant in any patient situation. The patient comes in, you're taking their vital signs, and you're obtaining medical history. You really wouldn't be jumping in and doing any sort of performance on the patient unless it was really a true emergency and you're CPR trained and maybe that's what you're going into with the patient. But for the purposes of this question, the initial action of the medical assistant is to obtain vital signs and a medical history. So we will go with option B, but let's take a look at option C and D. Option C states to wrap the ankle with an elastic bandage and assess for pain. And option D states prepare the patient for an x-ray examination. So actually option C, option D, and option A are kind of all stating the same thing and are all incorrect for the same reason, that all of these are medical interventions that will be determined by the provider and are not the responsibility of the medical assistant. So going back to how we started this question, where we crossed out the beginning part and just looked at the question as, what is the most appropriate initial action for a medical assistant? If that was the question alone, you would know right away that option B, obtain the patient's vital signs and medical history, which is the correct choice for this question.